One person commits suicide every 40 seconds, more than all yearly victims of wars and natural disasters, with the highest toll among the elderly, the United Nations said on Thursday in its first report on suicide. Prior to the 2013 federal election, the Coalition Party made improving mental health services in rural Australia one of its signature policies. Among the documents it used in the election campaign was the Department of Health's Hidden Toll Report on Mental Health. The policy outlined a national approach to mental health, suicide prevention, recommended funding for prevention awareness campaigns and strategies for rural and regional care. But this week the coalition voted against the motion, calling on it to deliver on one of its election promises, to implement the recommendations of a federal government report on suicide prevention.
I believe that from the evidence that was presented through the existing federal inquiry, there doesn't need to be any delay in implementing those strategies that could help to prevent suicide in our community.
More recently, the emergence of registered harm prevention charities has become more frequent in an attempt to tackle this devastating new growth. In 2007, the non-profit organisation Wings of Hope, working in the area of mental health, was developed, with aims of working to reduce suicide in the community by supporting people who have been bereaved by suicide. They have undertaken various initiatives for people suffering from suicide ideation, including the release of the new project Red Chocolate Elephants.
Following a suicide loss, people are usually really shocked. It's usually been very unexpected, and for a person to know that they're not alone is really vital to reduce their sense of isolation.
Red Chocolate Elephants provides adults with understanding and assistance to support children experiencing the loss of a parent to suicide is now a readily available benefit.
It is crucial we continue working towards breaking down the stigma surrounding suicide, reducing isolation and supporting children and young people following a suicide death.
Previously, there have been no resources available that specifically deal with children's fears and questions surrounding suicide, as it remains a very taboo area. And while Wings of Hope is a small organisation, it continues to spread its wings for suicide.